If you've been dealing with cervicogenic dizziness and lately you started noticing TMJ or jaw pain, this video is for you. Most people don't realize that there's a shared connection between jaw pain and dizziness with the cervical spine. When one is off, the other one pays for it. I recently started working with a patient, a nice lady who went for a massage, irritated her neck, and later she started to get headaches and she started to get dizziness. When I started to get into her treatments, we're giving her some things to make her neck feel better. Dizziness is getting better. Headaches are starting to get better. And she's like, by the way, I'm also getting jaw tightness and jaw pain. The muscles in the jaw just feel like they're so tight and they're clenching. She noticed a connection. When her neck was sore and she started to get the headache, that's when her jaw was really tight. So let's talk about what's going on behind the scenes. There is a neural connection between the upper neck, C1, C2, and C3, and a nerve called the trigeminal nerve. The trigeminal nerve has 3 branches. It goes out above your eyebrow, into your head, into your sinus cavity, and into your jaw. And the 2 branches give sensation to the skin, but the bottom branch controls the muscles of chewing. One particular muscle that we'll talk about is the Masseter muscle, a very large muscle. Kind of comes from the bottom of this bone here, which is called the zygomatic arch, and it comes down and connects to this part of the jawbone that we call the mandible. So when your trigeminal nerve is irritated, this could make this masseter muscle extremely tight. This could lead to jaw feeling like it's hard to open. You could have a decreased amount of opening. You should have about 40 to 50 millimeters of opening in your mouth, and you'll see that significantly decrease. You can start to get popping and clicking. And what's going on behind the scenes, your upper neck, it has a direct influence on the trigeminal nerve. The nerves of the upper neck, C1, C2, and C3, go into a shared tissue with the trigeminal nerve. So it makes me think of Siamese twins. When one twin's mad, the other one feels their symptoms. So if your upper neck is causing pain, clearly it can cause headaches. That's been proven. It can definitely cause dizziness. We talked in the last video about Doctors Ryan and Cope in 1955. They injected their upper neck with anesthetic drugs, and it caused vertigo and dizziness. And finally, now we've got really strong evidence that if the upper neck is sore, that could make your trigeminal nerve go a little bit crazy. That's going to tighten some of the TMJ muscles, and now you've got a TMJ problem. Well, what I've noticed when someone's having these disorders is you need specific treatment to your neck. So in this video, I'm going to show you 2 great techniques to help the neck, and stick around to the end of the video because I'm going to show you a great masseter release technique that you can do if you're having TMJ pain. Well, let's dive into exercise number 1. Exercise number 1 is going to be super important. It's going to be a posture correction exercise. If you're sitting and your posture is a little bit slouched at the lower back and your chin's a little bit protruded, guess what? The muscles at the base of the head, called the suboccipital muscles, they're going to become tight. When the suboccipital muscles become tight, that becomes an irritant to that whole system we mentioned, the trigeminal nerve connecting to the upper cervical. So you could do all the great exercises, get massages every week, but if you sit all day at your computer with your head protruding forward, guess what? It's going to make your occipital muscles tight, and it's going to make everything worse. So here's a nice drill that you can do. When you're sitting at your desk, or maybe you're at home paying bills, every 15 minutes, grow tall from a slumped posture, bring your chin to neutral, relax your shoulders, and hold that for 10 seconds. When you do that corrective exercise, it lengthens the occipital muscles, which helps decrease pain and tension. It strengthens the deep stabilizing muscles of the neck. That protects your neck and prevents arthritis and disc degeneration. Doing this frequently during the day can be a great help. If you're having severe dizziness and it's hard to do exercises where your head goes side to side and up and down, I've had a lot of success with my patients practicing this frequently during the day. Every time you walk to get a glass of water, take that nice neutral posture while you're walking. Walk across the parking lot to your car, take that posture. And every time you do that, you're breathing life back into your neck. Now let's talk about exercise number 2. If you have a specific tightness in the joints of your neck, you may be limited in rotation, you may be limited in extension. So a good way to test to see if your neck might be involved with your jaw or dizziness is start with a range of motion assessment. Do you feel any tightness, pain, or dizziness when you rotate left? Do you feel any tightness or pain when you rotate to the right? If you did that rotation assessment and you noticed it kind of made your jaw feel extra tight, that's a sign. Also, you may have noticed it may have made you dizzy at in range. That could also be a sign. You'd want to check bringing your chin to your chest. Does that cause increased neck pain, dizziness, or does it make your jaw feel tight? That's what we're looking for. Finally, we'll look at extension, assessing the same parameters, and then we could bring your ear to your shoulder and bring your ear to your other shoulder. Now, one thing that you could do is you could palpate your TMJ right here at the corner where your head and your jaw meets and see if there's tenderness. And then after you do your range of motion assessment, go back and palpate a second time to see if it changed it. Sometimes when you're moving your neck around, it can be a little bit of an irritant to your upper neck, and you might notice that your jaw feels a little worse. That would be a sign that your upper neck and your TMJ are related. In my last video, I showed you, in case you guys didn't see it last week, definitely want to check it out. I showed you a technique to help if you have dizziness with going to extension. I'll show you that one more time. I've got a little band here called a mulligan cervical strap, and what you want to do is place it at the base of your head right where your C2 vertebra is. If you run your finger down the back of your skull, the first bump you get to after the skull is C1. Go about 1 finger's worth further down, and that's going to be C2. And you can know you're on C2 if you do a little test. You go back and forth, and you'll feel a little bony prominence poking into your finger. So if you have dizziness with looking up, this could be a great technique. You place the strap at the C2 vertebra, and then you go up with the strap and you look up at the same time, making sure there's no dizziness or pain. You try this maybe 2 times on your first day and then reassess to see if it feels easier. Make sure it's not causing dizziness, of course. If you palpated your jaw earlier and you felt that that was tight, now after you've done this technique, go ahead and repalpate your jaw again and see if it feels less tender. Now, maybe with your assessment earlier, the range of motion irritated the jaw, but this could very easily cause relief to the jaw once you do that technique, because you're correcting a gliding malfunction at your neck. But you could easily build up to where you could do 6 reps of this, and you could do this 2 or 3 times during your workday. Get one of these on Amazon. They're about $15 or $16. Or you could take a medium-sized hand towel, use the sewn edge of the towel, place that in the back of your neck, and that could work in lieu of the strap. Easy technique, definitely worth trying. All right, I promised a bonus technique to release the tense muscles at the jaw for TMJ pain, so let's go over that right now. The muscle that we're going to focus on is called the masseter muscle. It is the strongest muscle in the body. That's an interesting piece of trivia. This bone here on the cheek is called the zygomatic arch. And what happens is it connects here below it, and it goes all the way down to the corner of your jawbone, the mandible. It is constantly working when you're chewing, and it's also working when you're talking, so it gets a lot of use. This muscle can be very tight and very painful. So you could start by palpating to see if that feels tight one side relative to the other. If you notice that it is tighter, let's say on the right side, here's something that you could do. We're going to take your middle knuckles, you're going to place it right below that zygomatic arch, and gently glide it downward towards the corner of your jaw, stroking all the way down with a nice pressure. Not enough pressure to hurt, but just enough pressure to get a nice massage to your masseter muscle. You could repeat this for about 30 or 40 seconds. And this could easily be a 2 or 3 time a day exercise. If you're trying it right now, I think it feels great to my masseter muscle. So see what you think. And then when you're done, reassess palpating at the TMJ and at that muscle and see if it gives you a little relief. If the exercises don't give you the exact relief that you want, make sure that you check out this video I'm going to put up here that's going to go connect you to one of my best exercise videos where you're going to get a lot of strengthening and stabilization. That's always going to be your long-term relief. And again, if it doesn't quite give you the relief that you need, you can always seek out a good manual therapist in your neighborhood, someone that's Maitland trained or Mulligan trained that can help you. Sometimes doing these things yourself can be a great help, but then sometimes you need to recruit professional help as well. Well, that's the video, and that answers the question, can cervicogenic dizziness and neck pain cause TMJ? Turns out it can. Well, thanks for watching, guys. Remember, my new book's coming out, and if you want more detailed explanations and exercises, it's all in the description. You're going to see the link to my book. And check out the next video next week by subscribing to our channel so you never miss a video. Thanks for watching, and we'll see you next time on Physio Tips Tomorrow.